ID. I'm gonna scan my room. Okay, so the first thing that I would do is verify orders and hospital policy. And then I would gather my equipment, which I've already done, and then perform hand hygiene. And I will verify patient identity using the patient's armband and compare it to the chart. I have Jaguar Jones, date of birth 8/25/63, 8/25/63, medical record number 417-417-6352, 6352. And then I would verify allergies on the allergy band and compare it to the patient's chart. I have allergies, penicillin, and then I would ask the patient if they have any other allergies that I need to know about. So then I would explain the procedure to the patient, pull the curtain to provide privacy, and now I'm going to inspect and palpate around the insertion site. And if I see any oozing or drainage, I would know that I need to obtain a culture swab and then send it to the lab. So then after that, I would position the bedside table to the side closest to the central line, and I would have it at waist height, and I would place my equipment on it, and then position the trash can nearby, and then perform hand hygiene. And then after that, I would raise the bed to a working height, lower the side rail, and position the patient comfortably with the head slightly elevated. And I would make sure that nothing was in the way of the central line dressing. So then I would don my mask and my goggles. And then I would help the patient put on their mask. So then I'm going to pull down my mask. So then after that, I would apply my clean gloves. Okay, now I'm going to remove the Tegaderm dressing and the BioPatch. I'm going to stabilize the catheter and pull towards the insertion site. And then I will dispose of it in my glove hand. And then perform hand hygiene. And I would assess the catheter, the insertion site, and the surrounding skin for signs and symptoms of infection or complications. And if I was going to obtain a culture swab, now is the time that I would do that. So now I'm going to open my kit. Now I'm going to contaminate and move over here so you can watch me don my sterile gloves. And of course, I would be working above waist level. Okay, now I'm going to contaminate again and move back over here. Now I'm going to arrange my supplies on my sterile field while maintaining the 1-inch border. And then I would open my alcohol swabs, but I'm not going to use them. I'm going to use what I would use for the culture swab and pretend that it's my alcohol swab. So I would then stabilize the catheter, and clean from the insertion site outwards, being sure that I don't go over the same area twice. And then I would dispose. And then after that, I would take the chlorhexidine and I would activate it by pressing these in. And then I would vigorously clean the catheter and the surrounding site, going back and forth and horizontal. And I would do this for at least 30 seconds, and then I would allow it to dry completely. So then after that, I would put on the bio patch. And now I'm going to apply the Tegaderm. So then I would remove my gloves. Now, I wouldn't remove them like this. Maybe I should show that. I probably should. I keep having to reuse them over and over again. I would remove my gloves. And dispose of them. And then perform hand hygiene. And then after that, I would write the date, time, and my initials, and then apply it to the outer part of the dressing. And then I would remove my mask, and then remove the patient's mask. And then I would reposition the patient, lower the bed to the lowest position, raise the side rail, make sure the collar light is within reach, make sure they have anything that they may need. And then perform hand hygiene. And then I would move on to documentation. I would document the site appearance, the amount and characteristics of drainage, if a culture was obtained, the type of cleanser used, the type of dressing applied, the patient's response, the date and time, and my signature.